See You Now is a podcast highlighting the innovative and human-centered solutions that nurses are coming up with to solve for today's most challenging healthcare problems. Created in collaboration with Johnson & Johnson and the American Nurses Association and hosted by nurse economist and health tech specialist Shauna Butler.
I'm Shauna Butler, the host of See You Now, a podcast that shines a light on how nurses are addressing today's most challenging healthcare problems. And right now, it feels like a floodlight. Over the past few weeks, See You Now paused its regular format so we could share stories from the nurses in the midst of the coronavirus pandemic. The uncertainty of not knowing how long this pandemic will last is causing anxiety, tension, and irritability. The added stressors of strained income, job loss, childcare and homeschooling, and health anxiety, which when compounded are all the conditions that experts warn can lead to domestic abuse and violence. Indeed, everyone from local law enforcement, hospital emergency departments, and the United Nations have raised the alarm of soaring domestic violence reports around the world. The disruption of routines, jobs evaporating, and being isolated from others means the modest net of abuse detection and alleviation for those experiencing domestic abuse, like schools, workplaces, and faith communities, have been completely unraveled. In this episode of See You Now, nurse scientist Camille Burnett takes us to the front line that so many of us are spending lots of time on, the home front. What happens to those who are sheltering in place when that place isn't safe? And how are nurses well positioned to help?
There's an assumption that staying at home is a safe place for everyone, and it's not. My name is Camille Burnett, and I am a nurse scientist. I do research in the area of intimate partner violence, health equity, and public health. I am a faculty member at the University of Kentucky College of Nursing. When I was hearing the shelter-in-place orders and the recommendation that people need to stay at home, my first thought about that was what about people who can't do that safely? For someone who's in an abusive situation, a stay-at-home order is something that would be very difficult to escape. It further complicates their situation. It puts them at further risk, and they're already at a high risk of being abused. There's no options for them to escape the abuser or the abusive behavior. And so it jeopardizes their safety, the safety of their family, their children, and it jeopardizes their psychological safety as well. With this changing environment is the uncertainty, and with that uncertainty comes anxiety and stress. And when you have additional stressors and anxiety within a home that's already volatile, what that does is increases the risk of an outburst or expedited abuse cycle. And that's what's happening. We are seeing an increase in calls and an increase in reports of domestic violence. I was really shocked that we could have that type of order put in place without having a plan of action for how we would deal with people who cannot stay at home safely. There's issues of economics, there's issues of housing, there's issues of mental health. There's all these different issues that come into play. One of the lessons learned from COVID is that none of these issues can be siloed. We have to recognize that what affects one group affects the other. COVID-19 has really brought to the forefront the need to address not just the issues at hand, but more so the root causes and then the prevention aspects of those root causes as well. Agencies who deliver services to support women and families exposed to intimate partner violence, these services were already under-resourced before they had this extra layer of strain. So there was already a struggle for many of these agencies just to meet the basic needs of these women. And so when you see these added strains on top of the existing structure, what it does is it illuminates where there has been enormous gaps and where there's opportunities. The issue of violence against women is a societal issue, and we need to recognize that this might be a new way forward in terms of all of us helping address violence against women, listening to your neighbor a little bit more intently, What are you picking up on? If you have an opportunity to connect with your neighbor in the backyard while you're getting some fresh air, there's an opportunity to say to the neighbor, hey, if you see my light go on and off twice, that means get help. And so there's ways in which people are exercising active living in a more caring and compassionate way and looking out for their neighbor in a way that might not have been thought of before. In Europe, local pharmacies are becoming a place where women who are exposed to intimate partner violence can go there and say a safe word, and then the pharmacy can respond in terms of getting them help there or offering them additional supports and resources. The great thing about nurses is that our unique role in preventing violence is that we are at multiple access points across the system and in the community. And so it's not like you can only go to one space within the community and find a nurse. Might be a hospital setting. However, we have nurses that are in the home care setting. We have nurses that are in schools. We have nurses that are researchers and out in the community collecting information. We have parish nurses that work in churches. And so at every point of contact that relates to the human condition, you have the opportunity to have the presence of a nurse. And because of that, we're uniquely positioned to connect with people at different spaces in their life. And because of that, we can screen, we can assess, and we can intervene related to intimate partner violence at an individual level, at a community level, and at a systemic level, because we have the expertise at all of those levels to help shape and inform the conversation on intimate partner violence and also to help the lives of the people who are experiencing it.
People have been coming up with clever and creative ways to stay connected to family, friends, coworkers, and neighbors during this time of physical distancing and isolation. As we communicate during these unusual and temporary circumstances, we're also learning new ways to perceive and identify needs and to offer help. Camille reminds us that thinking about the overall health and well-being of our society means that we need to be thinking about how people are living, not just about keeping them alive. Domestic violence may happen in the home, but it is a societal issue. And as societies and communities, we have to make plans to keep everyone safe. So much has changed, and so quickly. We're all a little unmoored. There is no shame in asking for help during these times of unprecedented stress. We are all feeling it. Watching out for neighbors and friends, texting or video conferencing with them to ask how they're doing, or offering to pick up groceries or balloons, or swinging by to celebrate a physically distanced birthday or graduation, are all surprisingly effective touch points for diffusing tension and preventing devastating harm. Eventually, this viral infection will be under control, and we'll all be able to hug our friends and family. Until then, we want to make sure everyone is physically and psychologically safe through all this. We hope See You Now is a calming voice, one that shares information-rich stories that increase your understanding of what's happening now and provide the perspective and confidence you need to get through to whatever is next. We're all in this together. For See You Now, I'm Shauna Butler. Take care of yourself, and if you can, help someone else too.
Johnson & Johnson and the American Nurses Foundation are excited to launch the Coronavirus Response Fund for Nurses. Go to the American Nurses Foundation website to learn more, share, or donate. And thanks.